The New Jersey Black Issues Convention believes that there are many, many important and effective programs and operations being initiated all over the state of New Jersey. And as is the case with our youth, and is in many instances the case, just not enough attention is drawn to them. About 5 years ago, we made the decision to initiate a process by which we would ask member organizations and non-member organizations to identify projects that they thought were having an impact, positive impact in our community. What our thinking was that we could catalog those programs, list them on our website, and perhaps encourage other communities who are facing the same difficulties to select from those best practices and implement those programs. In other instances, we wanted to make certain that the funders who sometimes can't seem to find our organizations that are community-based would find out that these programs were well-based, evidence-based, as they like to say now, and effective, and have the opportunity to raise resources to bring these programs to scale in our communities. Tonight, we are pleased to present 4 additional awards, one each in the area of economic security and opportunity, education, health and human services, and law, justice, and public safety.
And reduce or discontinue the use of medications for comorbidities of obesity. It also prompted our workforce to come together to raise money to build their own on-site fitness center.
So we started with our employees, took it out into the community, and we're really trying to move away from episodic illness and more into prevention and education. And we've done that successfully with our community losing at approximately 15,000 pounds that we know of.
The Beth took this program to the schools as part of their Kids Fit program, the local and state elected officials, and the area houses of worship.
The response was overwhelming. At first, many people were very hesitant because, they didn't want to, weigh in. They didn't want to be found that they were really, out of shape and overweight. But after Barbara came in and did a nutritional class with us, many people's hesitancy dissolved and they became more part of it, and it just swelled. We became more aware of what we're eating, became more aware on how important wellness is, and many people are sticking with it even now after the challenge has ceased.
What began as an indoor market in the lobby of the medical center providing fresh produce from the greenhouse to employees and patient families morphed into the Beth Garden.
The Beth Garden actually completes our whole wellness picture, if you will. To make sure that people are healthy, you can't only just teach them what to eat if they don't have access to the very foods that you're teaching them to eat. We developed this garden in a parking lot of ours. We partnered with a urban farmer who was a greenhouse farmer.
People have a lot of interest, they have a lot of knowledge, they just don't have access. And they also don't have time like everyone else. So by growing by the hospital, there are 4,000 employees here. That allows us to give access to 4,000 community members. And in 2 years, we have grown probably 15,000 pounds of food. We grow them in these earth boxes. They're sub-irrigation boxes, so in one box, we can grow 30 pounds of food, so you multiply that by 500.
We've had great feedback from our community. We've lost, including our hospital as well as the community, about 15,000 pounds. We have decreased the number of patients that require blood pressure medicines, and those patients with high cholesterol, we've helped treat them with diets versus medications. It's really helped us to be a part of the community and to be out there with the community in this health and wellness program.
It helps us to know that the hospital is not just there for us to go in to get well, but yet that they're here for the community. And Beth Israel has helped us to see that, and we have taken up that challenge to make this a great effort, not only just with Beth Israel, but also with the church and with the community.
Receiving the award for Beth Israel is Barbara Mintz, the Vice President of Wellness for Barnabas Medicare. As Barbara comes, I'm wondering whether or not the other members of the Barnabas team might want to join her. On behalf of the Black Issues Convention, it is my pleasure to present you with the 2013 Black Issues Convention Community Change Award in the area of health and wellness.
Thank you so much.
It is really an honor to be here and to accept this beautiful award. I just want to thank Jerry Harris of the New Jersey Black Issues Convention and Assemblywoman Elise Evans, and really all of those who care about our communities as much as we do at Barnabas Health. I would also like to say that it is really a privilege to work for an organization whose mission is to bring health and wellness to the community.